Good morning, everyone. Today I'm going to be talking to you about how to pass the MRCOG Part 3 exam. I'm going to be discussing and I'm going to be sharing with you the resources, my tips and tricks on how to approach the exam. Because one of the important thing about these exams is you want to have the right information from the start. I wish somebody had done this video for me when I was going to undertake the Part 3 exam. So I knew all this before even getting started. But what in fact happened for me was I had to go through the entire preparation, the exam itself, all on my own, and to figure it out all retrospect. So I'm hoping you don't have to do the same because you've got this video to watch. So if you stick around and watch the entire video, then I'm going to share with you where to start, what resources to look out for. Um, what courses I found useful, what books and things to use, and also how to prepare your mindset for the exam, because this is quite a different exam to the part two. And well done on passing the part two, because that was the hard nut to crack. So if you've cracked that one, then you're already a step ahead. Okay, so in terms of timings, I would say that as soon as you've done your part two exam and you've got your results, I'd say that you log on to the RCOG website and have a look at the timings for your next part three exam. And whenever that exam is, so for example, if you did the part two in July, and if the next part three exam is in November, then please go ahead and book that exam. It's enough time between doing your exam in July to getting your results in August to then preparing and attempting the part three in November. That is plenty of time. And the sooner you do the exam after part two, the better for you, because you will remember a lot of the information, hopefully, that you've revised for your part two, because all of that's going to come in very handy when you're trying to do your structured history taking, your question and answers with the examiners. All of that's going to become quite useful for you, and it saves you from having to revise all of that material once again. So say you got your results in August, and then you logged on to the website, and whenever the registration and everything opened, you registered for it. Then you've got August, September, October, and the exam would be in November. So that would give you roughly about 12 weeks, which is 3 months, which as I said, is plenty of time to prepare for part three. Because usually, when you do your part two exam, you're already doing your clinical practice. So you are working as a registrar in whereabouts you are in the world. So you have got a lot of the clinical experience with you, and it's now just about focusing your mind into what the examiners are looking for the part three exam, and that's what you need. So that's more like a fine tuning that you just need to develop, and that would then and you'll have no difficulty passing your part three exam. So I think 3 months are more than okay. It gives you enough time to look over what you need to do. It gives you enough time to watch videos like this, where I'm going to be sharing with you the mindset, the resources, and so forth. So now that you've registered for the exam, and you've at least thought about the dates, um, then you need to start collecting some resources. um, Now, these are the books that I used for preparing for my part three, and I found them really, really useful. And the kind of scenarios and the tasks that were covered in this book, I thought they were very, very similar to what the actual exam um, questions were like. So the first book here, which is the blue one, which is the Your Essential Revision Guide. Now this is the book I started with. It's got questions, it's got what the examiners are looking for. If they want you to take a history taking task, then it talks about the history itself and the kind of questions you want to be asking for, and so forth. So it's a very, very comprehensive book. And if there was one book that you needed to get, it's this book that you need to be definitely be having for the part 3 exam. So start off with this book because it sets you off really well in terms of how to narrow down your history taking, how to in your counseling station, what kind of things you need to be covering. This book has got it all. Um, and the way to use this book initially is, so when I got the book initially, I just picked up a task, read the task, on from the book, and tried to think about what I would ask the patient if this patient was in real life sat opposite me, and I had to take a history from them. So, for example, if they came in with, heavy bleeding, what kind of questions I'd ask, and what would I be thinking in terms of investigations and treatment options for these patients, and depending on their age, what kind of interventions I could offer to them. What I then did was then have a look at the mark scheme to see, was I on the right line? So was I thinking what the book wanted me to think, or what the examiner wanted me to think? And if, for example, I wasn't, or I wasn't covering the right things, then I would try and read through them to see where I was going wrong. So I did that for a couple of like the fetal medicine scenarios, so especially the ones that we, as registrars here in the UK, don't tend to cover a lot in clinics, like seeing patients who've just had diagnosis of Down syndrome, or any congenital anomalies. We don't really tend to see them firsthand. Um, so what I would do is again read a task like that and then think about, okay, how would I approach this? What kind of words can I use to say to my patient? How would I break this bad news to them? Or is it really bad news, And because for some patients, they might totally go with it and go, actually, you know what, this is what it is, and this is what my pregnancy is, and I'm just gonna see how it goes. Well, others might be very much of the opinion that they want to go for termination. So you don't know where your patients are sitting until you've had a chat with them. So it's not truly bad news, but it's something that you need to break to your patient, and see how they react, and then take the consultation from there. So I would again think about what kind of questions I'd ask, and then go into what kind of things I needed to cover as well, in order to give them the information about the particular condition. I'd then read the mark scheme and see if I was on the right line. So for the first few, I would say, weeks of my preparation, that's majoritarily what I did. I didn't really practice with anyone. I just went through these scenarios in my head. Whenever I got some time in between my clinics, or on a labor ward shift where I had some time, I just sit and read, or in the evenings, and so forth. So whenever I got some time, I didn't really set myself any tasks that I had to cover these main tasks by this date or anything. I just took it as the day went along, kind of a thing. So if on a particular day I had more time, like on the weekends, I'd do more. If I didn't have much time, then I just do one or two scenarios. But mainly think about where the mark scheme is heading. So that would give me an idea of what the examiners were looking for. So that's what I did, at least for the first 4 to 5 weeks of my 12 weeks, for my exam preparation. The second book I've got here, the Get Through MRCOG Part 3, is also quite a good book. It's also got lots of scenarios, different ones to the ones covered in the first book. So if you did want to get another resource, and that'd be a good handy resource to use as well. Now, these are also the books that I used. Now, what I then did, so after my first sort of 4 to 5 weeks where I was doing more of my own preparation, um, I then, grouped in with. I found a group that who were also revising for the Part 3 exam, and we could just, meet along online through Zoom and through Teams, and we'd set times and say, so it'd be three of us, and one of us would be the examiner, one of us would be the candidate, one of us would be the patient, and we would mark each other and see if we had covered everything, and also how, what our consultation style was, for example, and if we were asking everything that we needed to ask in the right manner, and if we were giving the information in the right manner, and so forth. So these books, so out of the four books, if I had to choose two books, it would be the first one that I showed you, the blue one, and this last one, which is the tasks for Part 3 MRCOG clinical assessment. So this task book and the first book were the books that I really, really would recommend if you had to choose two from the four. But if not, then get all the four if you can, because the more you practice you do, this exam is all about practice. So the more practice you do, the better you become in focusing your questions, your consultation style to exactly how the examiners wanted, and you'll have no problems in passing this exam. Um, so for the last sort of 3 to 4 weeks of my preparation for the exam, I just really focused on setting up these groups and making sure we had mutual times that we could meet up. And for me, the exam was virtual, so practicing it virtually really helped, because that's exactly how we were going to do it in real life, in when we were going to see the patients. So it helped to do it online on the screen, and just we just went through. So not a long time actually, but even if you just gave yourself an hour when you got, when you all meet in a group, that would be more than enough. Because in that hour, you can at least go through two scenarios each, or definitely one scenario each, but maybe two for somebody, and not for the rest. But at least you can cover a lot of the scenarios, because even by just listening and seeing how other people tackle the scenarios helps a lot in your learning, because then you can see where you need to focus, if you were given the same scenario. It also helps you learn, because you can see how the other person has questioned, and so forth. So I found practicing in a group really, really, really helpful. Now, right towards the end of nearer to the exam, I did find myself another friend of mine who had done the exam a couple of years ago. And what I would do is, she was quite a busy mum, and had a lot going on. But whenever she was free in the evenings, we'd go through, say, a few scenarios. So she'd had the book, I'd had the book, I'd be the candidate, she'd be the examiner, or she would be the patient if the scenario wanted it like that. And I would just question her. She would, if she was a patient, and if she was the examiner, she'd question me, and make me think about my answers, and then give me feedback. And because she'd done the exam before, it really helped, because she could give me that insight into what the exam was looking for, and if I was diverging somewhere or going off the wrong path, she could correct it for me. So that really, really helped. Now, the other thing that I would really, really strongly recommend is contacting your consultants. Now, some of your consultants in your hospital practices will definitely be examiners for the Part 3. Um, and they will, especially for the university hospitals. So please contact them and see, and try and do a few scenarios with them. So you don't have to. It's very unlikely that they'll give you lots of time, but even if they did just one or two scenarios with you, especially difficult ones like the fetal medicine ones, and the gynaecology ones, if you're not so used to seeing those patients in clinic, then just practice those scenarios with them, because what valuable insight they give you and the feedback they provide you it's second to none. No course or practicing with friends or anything is going to help you as much. Really, really strongly recommend that you set up, even if they give you half an hour, but just say, can I please come and see you on that day or whatever, whenever they're free to say, just be as flexible as you can. If they give you some time on the weekend or in the evenings after they finish their clinic or whatever, just really stick behind and go through this with them, because that would really, really help you. Because they do the examiners see lots of patients and lots of candidates on the day, and some of these consultants have been doing it for years. So even if they just went through one scenario with you, they would provide you with real insight into what the examiner is actually looking for, and whether you've got, and also give you the confidence if this consultant thought you were on the right page and you were asking the right questions, then they'll give you the confidence that you're doing the right thing. So do please find consultants in your hospitals who have done not only done the exam, but are examiners, so that you can who can just do a couple of practice scenarios with you, because that's going to really, really help you. In terms of the guidelines, now I get asked this a lot. So do I need to prepare the guidelines? Do I have to go through the guidelines? What guidelines do I have to go through? And so forth. It's a very, very common question. And what I would say is you do need the material knowledge and the theoretical knowledge behind whatever you're going to tell your patients. So if you're going to talk about even something simple like heavy menstrual bleeding, you need to know what the causes are. You need to know what the investigations are. You need to know what the treatment options are next. So you need to have a bit of knowledge about what you're talking about with the patient, and obviously the guidelines provide you with that knowledge. So I would say that whatever material you've prepared for your MRCOG Part 2 in terms of revision notes, please go through it as well, because believe me or not, there will be some stations in your exam where they will ask you an entire guideline, for example. So, like a recurrent miscarriage station, where they'll ask you the causes, the investigations, a prophylactic treatment, all that kind of stuff. So, stuff that's covered in the guideline really, really well. So if you read that guideline, you'd have no problems, getting through the exam. Similarly, things like the PMS, the bladder pain syndrome guidelines. So those guidelines that we don't tend to use a lot in day-to-day clinical practice, but equally in an exam, there could be a station where they just ask you about that, about bladder pain syndrome. So if you know the causes and investigations and treatments, then there'll be no difficulty for you at all, and it'll be like an easy pass in that station. So I would strongly recommend that you do read your guidelines again. So you don't need to read each guideline in as much depth as you did for part 2, but you do need to know your numbers. You do need to know your material, your theory behind things, because that will be questioned, and it'll be very obvious if you don't know about a condition you're trying to explain to a patient what the next steps are or where they go from here. It'll be very obvious if you know it or if you don't know it, especially to the examiner. Because so having that information and that knowledge is very important. So I'd say that, I don't think you need to read word to word every guideline, but as I said, if you've made some revision notes for your part 2, then please go through them and just read those guidelines, because that's going to really, really help you in answering the questions for part 3, and it'll also give you the confidence in attempting the exam head on, and not not feeling like you might, there might be a station that might come up and you might not know the answer to, and so forth. So to take away that fear completely, just do the guidelines. So group work, as I've covered before, is absolutely essential in passing this exam. I cannot emphasize this enough. This exam is all about practice. It's not about you digging into the books. If you're doing that, that's wrong. You have to practice. And if you can find somebody to practice from day one, that is beautiful. That's marvelous because that's what you need. Um, but if you can't find somebody from straight on, which I couldn't really, as much as I tried, then at least somebody for the last 2 to 3 weeks would really help you, try and gather what you need for the exam and just make your mindset and put your mindset in the right frame of mind to answer the part three the way they want you to answer. So group work is absolutely essential. So please find yourself at least two study partners. So three of you could be in a group, and you guys can share the role as you go along. In terms of courses, now there's several courses for the part three exam that are being advertised everywhere around the internet. You don't need to go far, and you'll find lots and lots of courses. Generally, all these courses are quite useful and helpful. The one I attended was the RCOG one, just because I thought that would be the most the most close to what the real exam would be like, and also because my exam was virtual. I didn't know if a lot of these courses had that experience of telling you what the virtual exam would look like. So I stuck with the RCOG one, and you know what, it was very very helpful because all the examiners were actually consultants, and they had lots of valuable feedback to give you, um, and get your mind in the right frame, in the right focus, to answer the questions in part three. So I would say that you do need to go on to at least one course. Some of my friends have gone actually on several of these courses, and they found it really really useful. I went on one. I would really strongly suggest that you go on at least one course, because by going on the course, you build up that confidence, because lots of these courses will have they'll run the stations just like the real exam would run it in terms of timings and so forth. So it would help you know whether you are going beyond your time, for example, in exam settings, and how you're doing, and getting feedback from lots of different people really helps in building your confidence, and you can know whether you're on the right lines. um, and I wouldn't suggest doing this course too early on either. So try and like frame, if you can do it, then do it within the 12 weeks that you're studying for the exam, because that's when you're going to find it most useful. um, and also it might be that when you're revising, you might come through a scenario and you think, oh, actually I'm not too sure about how to approach this. So when you go onto these courses, you can ask these questions about difficult scenarios, or how to answer it, or how much depth to go into, and so forth. That would, it'll help you clarify those questions before the exam day. So courses absolutely essential, at least one if not more, to get a wider perspective on the exam, and so you can try and then build your confidence, and see if you're on the right lines. And if you found a course useful, then if you are somebody who revises by going, who revises better by going on to courses, then you can always choose more than one. There's several courses happening up and down the country, so just pick one and try and attend, because that would help you, and really benefit you in the long run, because what you don't want to do is keep reattempting the exam. So if you can give it your best shot the first time, then absolutely go for it. Now it's very important that now you can do all this preparation for the exam, but when you get to the exam day, you can be very nervous, you can be panicking, you might not read the question properly, you might miss the point completely. What I want to tell you is, just imagine yourself on the exam day like you were sitting in a clinic and a patient was coming to you to ask about something. And you might know what they were going to ask you about, or you might not know what they're going to ask you about. But the patient comes in, asks you a question, and then you take it from there. Really put yourself in those shoes in on the exam day. Don't think of it as something that you can't do, or it might be too much and whatever. You're all doctors, you've all passed the part one and part two, you've all got the knowledge, and you are good enough to be sat here doing that exam. So just sit on that exam day with confidence, relaxed, just like you'd sit in clinic setting, and see what the scenario wants you to do. So, for example, a lot of these fetal medicine scenarios don't really want you to give a lot of information to the patient. All they want you to really do is, explore patient expectations, explore what the patient wants you to go through. So, for example, the patient might be somebody who really wants to go ahead and go for termination. um, to such a patient, what would really matter is that you just, go in, as soon as you start the scenario, you find out about her expectations from the consultation and go straight into it. She wouldn't care much about, um, you know, other things about the condition. So giving her all the theoretical knowledge about Down syndrome is not going to be of any use to her because she's already made up her mind that she wants a termination. Um, Obviously, there is some basic knowledge that you do have to give to the patients, but she's already made up her mind, so you just have to go straight into the scenario, because that's how you'll save up on time. But if you start diverging and talking about things that you don't need to talk about, you will find yourself really in a pickle, because you will not be able to cover what the question wants you to cover. And the questions for the part three are very, very specific. So and most of them you'll find out by just questioning the patient in front of you, just by a simple question like, "Oh, how can I help you today? My name is such and such." After you introduce yourself, just find out from the patient why they're here. And if they and the patient will start by saying, "Oh, I would like more information on this," or "I've just had a diagnosis," or "I've just had this test results back. I don't know what they mean." That means the patient wants you to go through the test results. So you then go through the test results. So it really helps you cater where you need to do in that scenario. So now that you will only be able to do if you are relaxed on the exam day. It's very, very, very crucial. Examiners can pick up when you are stressed. Patients can pick up when you are stressed and you are panicking and you're not listening to them. So lots of these scenarios will involve giving verbal cues to you, non-verbal cues to you, to help you get the points, from the station. So if you don't pick up on them because you're too stressed, thinking, about the exam, then you're not going to pick up on these cues, and unfortunately you will not be able to answer what the question wants you to do, and hence you'll end up failing the station. And a lot of people go wrong there. A lot of people, it's not that they don't have the knowledge, it's not that they're not good doctors, it's just the fact that they haven't read the question properly, and they're not relaxed enough to target their consultation to what's required. They'll go in asking X, Y, Z when that was not required at all, but wasting time. You've only really got 10 minutes in the station, and in the 10 minutes you want to um, you know give the patient your theoretical knowledge that's required, but also explore what the patient wants and agree to some sort of a mutual management plan. And you cannot do that if you are stressed. So whether it means a good, a night's sleep, good night's sleep before the exam, a walk if that helps you to relax, a bath, whatever you can relax with, then please, please, please do that before the exam. And on the exam day, don't stress with things like, especially if your exam is face to face, about traveling and your trains being late and all that kind of stuff, because all that adds to your exam stress. You want to be relaxed on that exam day. So if you can find yourself a hotel or stay with a friend the night before, then that would be the ideal thing to do, so you can get to the exam venue fresh, without having the worries of the travel and any delays that are not in your control, frankly speaking. So you don't want all these added stresses on the exam day. and read the question very, very carefully. The question will tell you what it wants. They're not trying to hide it from you. They're not making it difficult for you. The question says what it wants you to do. For example, it might be a patient who's just had some surgery and something has gone wrong, and they want you to discuss with them. They either want you to tell or tell what's happened to the patient, from the surgery, and they want you to see how the patient reacts and take it from there. So the scenarios can be quite dynamic. They can be quite different, but you are going to be that confident doctor who's passed their part one and their part two, and they know their knowledge, and they can handle any state, any scenario with confidence. And if they're not sure about anything, they will say, I am I'm going to check this with in the notes, or with my seniors, or with my matron, or whatever the scenario wants you to do. um, what you don't want to do is give the patient the wrong information just because you didn't have the right information. So you want to check your information. But equally, you want the patient to feel comfortable talking to you. You want the patient to feel that they've answered, that you have explored their ideas, their concerns, their expectations, and that will only happen if you allow that to happen in the scenario. So that's it really from me in terms of preparing for part three. So it's not a difficult exam. If you've done your part two, you've already done the hard bit. I cannot say this enough, but you've done the hard bit. This is not hard now because you do this on a daily basis. You manage patient expectations on a daily basis all the time, wherever in the world you practice obs and gynae, it doesn't matter, but you do this on a daily basis. So set yourself, so as soon as you've got your results from your part two, you want to get onto the website, find the registration date, get yourself registered for the next part three exam, find a course, book yourself on a course, and find a study partner. At least two, if you can, that would be ideal. And talk to people who've done the exam before, because that would, they'll be able to, pass on some useful advice as well. Like, for example, myself, and watching this video, you're definitely a step ahead, because I'm telling you everything I did for the exam and everything you should be doing from the day you find out you've passed your part two. You then want to be spending some time with those books, and then doing some practice stations with your friends. And then when you can attend a course, hopefully that will build your confidence. And you don't want to go into a course having done no preparation. I would really strongly urge you to have revised before going on into that course, because if you have done your revision, then you will approach that station on the course with a lot of confidence. And you will already have some idea of what this station might be looking for. But if you go into that course with having known nothing, then you can come out of that course feeling quite defeated. And you don't want to do that. You want courses to build you up, not to take you down. So practice something before going onto those courses. Don't just go in blind, because if you go in blind, you will definitely be disappointed, and don't be surprised about that. The courses are generally meant to be a lot harder than the real exam. So if you did come out of that course thinking, oh, actually, I did miss quite a few points, that's okay, because the courses stations always tend to be slightly a bit more trickier than the real exam. And that's what the RCOG course told us on the day as well, that if you found these stations okay, then you'll be okay in the exam, because these stations were actually quite hard. So yeah, so go into the course prepared, um, and then and revise some of your revision notes from your part two, because that would help keep your knowledge fresh. And on the exam day, drink caffeine, whatever you need to be the most alert, fresh as you can be. Do that. So whether that means a good breakfast for some people, for others it means no breakfast, but whatever will keep you fresh, will keep you um, you know um, active for longer, do that. The exam itself is an intense exam. You'll go from station to station, and you'll have lots of the curriculum covered. There'll be a teaching station, there'll be a gynae station, there'll be a gynae oncology station, there'll be a maternal medicine slash fetal medicine station. So there'll be lots and lots and lots of varied stations. So your brain will go from one bit to the other, to the other, to the other, to the other, with very little breaks in the middle. So just, so you need to be focused and you need to be functioning to your maximum on the exam day. You want to avoid triggers that might trigger your migraine, for example. So if you are somebody like me who suffers with migraines, then just avoid those triggers and avoid things that might trigger your migraine. So make sure you sleep well and you're well hydrated, and all that kind of stuff, because that's what's going to keep you the most relaxed, confident, and your best self on the exam day. And that's exactly what you need. Good luck revising. It's not a difficult exam. If I can do it, you all can do it. It's just about putting in the effort. And honestly, if you've passed your part two, you do not need to stress too much about the part three preparation. You just need to get your mind focused, and in the mark scheme of the examiners, because at the end of the day, you do need to say the right points for them to be able to tick you off. Um, and enable you to pass the exam. So if you do find this video useful, anything that I've said, that you think actually that resonates with you, then do please comment and let me know. And if you are somebody who's done the exam, then please share your tips and tricks for my fellow viewers so they can benefit from this.